The advice I have for emergency C-sections, don't have one. Don't need one, I suppose would be, but that does not help anyone. One, if you have a support person there and it's going to be a fast ride to the OR, they need to get gowned up as fast as they can. My husband didn't make it to the OR. They basically threw scrubs at him. I had labored all night. I forget what time it was. I don't think it was stupid early in the morning, but it was definitely like 5 or 6 in the morning. We'd been up all night, more or less. So they're like, things are going bad. We're taking her to the ER. Here's some scrubs. Put them on. And that's all. Yeah, if you're the support person, things are going to happen very fast, and you probably will be just sitting there clutching your scrubs as they wheel your person out, the patient out the door. Hopefully, if you do need, and not all C-sections are stats. Stats are where they literally say, we're going now, and they push you down the hall as fast as they possibly can to the OR. Most of the time, it doesn't happen quite that rapidly. It may be very unexpected. You may not have a lot of time to wrap your mind around it. Like, we need to take your baby out very soon, within the hour, and you're sitting here thinking, I did not sign up for a C-section. This wasn't my plan. And you're going to have to sit there and wrap your mind around it. But if you have time to think about it, know that they will take as good care of you as they possibly can. Nobody takes surgery lightly. They all know what they're doing in the OR. This is not where they put the amateurs. These are all very experienced people. So, and you should probably know that there will be a NICU team there. If it's going to be an unplanned C-section, there will probably be a NICU team there to look at your baby, make sure they're okay. They may need to take your baby to the NICU. They may not have time to stop and swing by and let you say hi to the baby. It's really nice if they do. I did not get that option. So if you want to see your baby before they go to the NICU, like, try to gently twist some arms so that happens. I mean, I really would have liked to see my son before he went to the NICU. Even though he looked terrible, I still would have wanted to see him, because as far as I did not see him at all. I did not hear him at all. All I know is they got him out, they hustled him over to the corner, intubated him, and then basically hustled him out the door and down to the NICU. That was the whole process. There was no swinging by mom. My husband saw him because he was standing outside the OR. As he went past, they didn't stop and let him say hi either. So I would say, if it's possible, and it probably is, they're taking him to the NICU, they've got 5 seconds to let you say hi, okay? Just saying, unless your baby's in really, really bad shape. That's okay.
Megan, did you see your son when he was going off to NICU, or did he just get whisked away too? Do you know?
I saw him it was like an hour and a half after he was born. He was, so not right away, because I wasn't even like conscious for it. When I was in recovery, they were transferring him. They had to stabilize him and all of that. They were kind of assessing the level of damage done at that point. And that's when they were suspecting that he had the hypoxic injury. The nurses were taking their gloved fingers, trying to get him to suck, and he wouldn't suck on anything or do any sort of normal baby reflexes. So I saw him, they really pulled out all the stops to do it. They felt so traumatized for me. They said, that hospital doesn't have things like ruptures often because they tend to have more lower risk pregnancies that go there, but they are next door to the hospital that has more of them. They felt so badly about everything, and they felt so bad for me and for my, that at the time husband, and that they managed to like 3 nurses and his little isolate managed to get him down for me to just poke my finger through at him real quick before they took him into the medical. They did a transfer over with a NICU team that came over to this hospital. The NICU team from the other hospital, the transport team came and got him, but they were able to sneak him to me real quick. I was gonna say, yeah, for the emergency one, I would just say that no matter what kind of birth that you think you're going to have, to just unless you're having a planned C-section, which of course then you're already packing for a C-section, but to just always like pack your bags and in the back of your head and all of that, just kind of plan that could be a thing if you're doing any sort of, whether it's your first time giving birth or you're doing a trial of labor, just to anticipate that it could end in that way. And if that's the case, that you just sort of at least have your bag packed for clothes that would be comfortable for that, and don't just think that it won't happen. So, small thing, but it'll save you in the long run if you kind of packed a little bit for whatever scenario.
I didn't do any childbirth education, but when I was looking over the materials I was given, and it was the execrable What to Expect, which I do not like that book at all. I did not really look at C-section information. I had no idea what a C-section was. I mean, I knew vaguely what it was. They cut into your uterus, they take the baby out. I didn't know anything about the operation. I didn't know anything about recovery. I didn't even know, I mean, when I finally found out what a C-section was, and that wasn't until after my second C-section, I looked up exactly how it all goes down, and I was like, wow, this is a really amazing procedure. I mean, they cut through your skin, they cut through your fat, they cut through that, and then they get to your muscles, and they don't cut through your muscles. They just push them out of the way. And I'm like, oh, they don't cut your muscles, because you're like, oh, the people who are like C-sections haters are like, oh, they cut through your abdominal muscles and they do all this damage. It's like, do not. They don't touch them. Any damage done to your abdominal muscles was not done during the surgery. It was done during pregnancy. And I had that too. So, and then they get to the uterus, they push the bladder out of the way, make sure it's all safe. And then they open up a big enough spot to see what they're cutting. They cut through the uterus very, very carefully until they're completely through. And then they just got to get your baby in a position to push them on out. And I'm like, wow, this is really cool. I was like, wow, this is
really cool. I think same thing when I first saw like a C-section, like a video of one actually happen, because I'm not squeamish at all when it comes to, as long as it's not watching myself, like I'm not squeamish at all, but they always talk about vaginal deliveries and like, wow, it's amazing how like a baby and like how it can come out of such a small opening. But have you seen the size of the little, spot that they make for a C-section? And you're like, how? And then you watch it and you're like, whoa, my mind was blown. I'm like, that is so cool. How did they get that big baby out of that little incision?
That also explains why you feel all this pressure and pushing, is because they get the head there, and then let me tell you, that head's not coming through that incision by itself, and they can't reach in and pull it out without it making the incision larger. So they just, do what your uterus does. They just give it a little pressure. Once the head comes through, then they can hold on to the head, guide the rest of the body out, and boom, baby. It's just so fast. It's really cool. And then they sew, and then they sew you up, and it's like, well, they used to do the upper ventral incisions for C-sections, and you're like, well, why did they do that? They had to go through the muscle to do that. That was, that's so invasive. And then you have this big scar, and then you have a scar on the uterus that weakens it, and you're like, oh, so they do this incision way down on your uterus where it's mostly connective tissue right above the pubic bone, and you're like, oh, this is so much better. This is pretty cool. it's still an incision, it's still scar tissue, it's still a weak spot, but it's a much better place to have a weak spot on the uterus than anywhere else.
You know what? That's another thing is, I mean, I was in the natural world, so we were made to like fear C-sections. But I wish that more people did know about C-sections. Like, I really wish there was more of us like talking about it and sharing, because it is really cool of C-sections are really neat. And I learn things about C-sections all the time. I've had 2 C-sections and I still don't know nearly anything compared to what there is about C-sections. I mean, even talking to Dr. Rebecca, she's like, yeah, sometimes we get in there, we'll make an incision, and sometimes they have to do like what they call like a J, I think is what it was, where they have to go up the side a little bit depending on what's going on with the baby. So somebody might have the little scar at the bottom, but the reality is they can't have a VBAC if they wanted one, because actually on the inside, they don't know that on the inside of their uterus has a little extra cut, which makes it more, it's not good, because you could get a rupture, and they have to monitor you very well during pregnancy too, because you could just rupture because it's like an extra spot of where they had to do extra work. And so that was something I was like, I didn't even know that was a thing. It's like, there's so much information that we just don't know about. And I think so many of us, I hate to say we don't want to know about C-sections, because we're like, no, I don't want to have C-section. I don't want to have surgery. But then it's like, people that have had it, it's like, man, I wish I would have known about this before. I wish I would have known, because the reality was it's actually not that bad. It wasn't as scary. It was like, I mean, anything's scary, but birth is actually pretty scary. Thinking about birth is just scary and unpredictable. But I feel like if we just knew more information about how, I mean, it is pretty cool. It's pretty interesting of like C-sections of how it is. And so I think that right there is something for somebody, even first time having a baby, or, your first time mom, whatever. It's not a bad thing for you to look into a C-section. And if you look and learn information about a C-section and are open to possibilities, it doesn't mean you're going to have a C-section. I mean, unless you want one, but it's like, it doesn't mean that you might still have a vaginal birth. It's not like that bad juju. Suddenly I looked at C-sections and I put my energy into them, and now I doomed myself and now I can't have a vaginal birth. That's not how it is. It's being like open and aware to the possibilities of something could happen, but you'll be better prepared for it if it does, like, honestly. And that is something that I would say my advice to somebody with an emergency C-section is, it's not a bad thing to be aware about C-sections, to be open enough to a C-section so it's not so scary, and like your expectations are not like dead set on a vaginal birth. But another thing that I hear a lot later on, we all talk about, or different people, is you didn't fail. You did not fail if you tried to have a vaginal birth and then you ended up, it resulted in a C-section. There's nothing you could have done to change anything. Nothing that you did during pregnancy. It wasn't that you didn't exercise enough. It wasn't that you didn't drink enough water, or you didn't sit on the birthing ball long enough. Like, it's not anything about that. It just happens. Like, things just happen during labor that is unpredictable. And that's why we have hospitals and doctors and tools and equipment and all the staff prepared for if those moments happen. So afterwards, if you end up in that situation, don't blame yourself, because I feel like there's a lot of us that have like this guilt. We have we feel bad, like we must have done something wrong, and now we're messed up and we didn't get our vaginal birth, that everybody's like, you must have a vaginal birth to be a mom, and you must have a vaginal birth. No, that's just not how it is. You having a C-section doesn't mean that you're not going to breastfeed your baby. It doesn't mean that you're not going to bond with your baby. It doesn't mean that your kid's going to hate you, or your kid's going to grow up different because it was a C-section. Like, nobody can tell the difference. When you go to schools, you cannot tell which ones were C-section kids and which ones were vaginal birth. You can't tell. You can't tell which ones were IVF kids and which ones were unplanned kids. You cannot tell the difference between them. Like, it doesn't work like that. But I feel like that is some kind of like stigma that they put on us. It's like, you must have a vaginal birth and you must have done something wrong if you didn't get your vaginal birth. And that's just not true. It's not true. And it drives me kind of crazy when I see this online all the time. of people like, well, what can I do? And then they want a VBAC so badly. What can I do to make sure I have my VBAC? But you know what? You know, birth is unpredictable. Like we just kind of have to accept like it is unpredictable and be prepared in the right place with the right team, with the right tools, and know that, you know, as long as you're okay and they're okay, then it's worth it. And another thing that I would say is, even if your kid didn't get rushed off to NICU, even if you didn't lose your kid and you have your kid and you're both okay and everybody says, look, you and your baby are fine. If it was scary, if it was traumatic, go get help. It's okay for you to get trauma help. It's okay to go see a counselor. It's okay to get that necessary help because it is traumatic. Birth is traumatic. I mean, I know people that have had vaginal births and it's traumatic and they've had to go through things from it and had to, you know, go the process of getting help. So I feel like that's another thing is that you can get help. And I wish more people were aware of like, it's okay to get help and you don't have to stuff it because you're a mom that just had a baby and then suddenly, you know, like, no, that's not how it works. Like, no, you're allowed to take care of yourself. You're allowed to get treatment and care. So if there's something holding you back because of whatever happened, traumatic or whatever, something out of that you were not expecting, you weren't planning, it wasn't part of your plan, it's okay to get care. There's nothing wrong with you and it's not selfish. It's you taking care of you. And the more you take care of you, the better you're going to be for your family anyways. And the better you're going to be for the future. So that would be my biggest thing is don't blame yourself and always, always go get help and be prepared because what you plan and what you think is not always what's going to happen. I mean, even with planned stuff, there was stuff that it was kind of a little bit of a surprise, but I mean, it was still a little bit more planned than the first time. So that would be my best advice is always take care of you and get that kind of help. And you're still one of us. Like, you're still one of us no matter what.
Well, one reason to look into C-sections, even if you don't plan on having one, and even if you don't end up having one, is you can support the people in your life who have had C-sections. If you say, oh, C-sections, okay, I know something about a C-section. Why don't you tell me about yours so I can understand what you've been through so I can support you? Quite possibly one of the most enraging things I hear when people say, oh, I had a C-section, is someone's like, I'm so sorry. I'm like, what? It's kind of like, that's what I would say if someone said, I had to have my foot amputated. It's like, oh my gosh, I'm so sorry. It's like, no, it's a C-section. It wasn't like some horrible, unrecoverable tragedy.
Yeah. And I wish people did more of like, whether you had a C-section or a vaginal birth, I wish people were like, how are you doing? How are you feeling? How are you? I don't know, every time any of my friends or family members, I always asked how they were doing. I always was like, you know, how are you doing? How are you recovering? How are you feeling from stuff? You know, that kind of thing. I wish more people, would ask those questions like, how are you feeling? You know, do you need any help? Like when you go home and stuff like that, sometimes like we might need to get a little rest. We need a nap in or something. You know what I mean? Like, so somebody come over to play with your baby for a couple hours so you can take a nap or so you can take a shower or like those are helpful. Those are helpful, like little moments and stuff. And I wish more people did that. And there's no reason to be sorry over a C-section like that. No, don't do that. But I wish we were paying more attention to like, kind of like us. And I wish more people around us were paying attention to, like, I really do. I wish that was kind of a thing. I mean, my situation was different. So by the time we had our son, you know, whatever, it was a different thing. So we had more helpful hands, I guess you could say, around us. I mean, even my brothers were like, I'll come help you and you need anything and let me pick that up for you and let me make you food and clean up. Like it's kind of like that. So it's like, it becomes like it takes a village is what they say. So I wish more of us were kind of like in a team working together and not so much like, oh, you had a C-section. that sucks. Like, no, we should be grateful that we had a C-section. Look what's happening. And like, you're alive, baby, like it's that kind of thing. So I think we should be rejoicing a little bit more and like not, I don't like all that stuff. I know exactly what you're saying about it because I don't like it. Like, I'm like, don't say that. There's nothing to be sorry about.